So in our next segment, we're going to go into Hawthorn Children's Psychiatric Hospital. You know, one of the things that is developed over the course of the last couple of years is the fact that mental health and wellness plays a critical component to our overall health. And the stigma from mental health is being reduced daily by healthcare professionals and really people alike. In fact, young people like yourselves are realizing that mental health is a critical aspect, one that is not something to be joked about, but taken seriously. So if you want to help children that have mental illnesses or different types of conditions that need support, you may be right for working at Hawthorn Children's Psychiatric Hospital. Their staff have a compassionate way of dealing with mental health and getting individuals back on track and living good, healthy lives. Let's see inside Hawthorn right now.
Hi, my name is Michael McFarland, and I am the Chief Operating Officer of Hawthorn Children's Psychiatric Hospital in Pagedale, Missouri. Hawthorn is a 44-bed facility serving the inpatient and residential needs of children and adolescents ages 6 to 17 who have acute mental health challenges and trauma histories. As you embark on your pursuit of a career that best fits your interests and either current or future abilities, you will ultimately have to answer for yourself the question of, what is it that I want to do with my life? Well, for many of us, including myself, this has been a lifelong question that I have revisited many times over the course of my 23 years in youth development and 12 years with the Department of Mental Health. As COO, I have the privilege of leading a diverse group of interdisciplinary mental health professionals in providing trauma-informed services to young people from underserved communities and limited financial resources. Much of my job is actually ensuring that as a hospital community, we are faithful to our mission and aspirational about how we can best meet the needs of children struggling in our community statewide to manage their medical and behavioral challenges. During the course of this video, you will meet some of my teammates who assist me with ensuring that we provide a safe environment for both staff and patients to provide active treatment in order to promote healing and recovery. Although we all occupy different roles within behavioral health, you will see that we successfully complement each other in assisting pediatric patients improve their short-term outcomes and return to their families and communities.
Hello, my name is Emily McCush, a clinical caseworker here at Hawthorn Children's Psychiatric Hospital. I've always been interested in mental health, even in high school. When I got my degree in psychology, I wanted to use it, so I browsed jobs online and an ad for Hawthorn caught my eye. I ended up as a psychiatric technician on the evening shift on inpatient, and after 6 months, I moved to the night shift while pursuing my master's in counseling. I eventually moved to a day shift position, and then an opportunity came up to become an education assistant, and I took it. All of this while going to night classes. Once I got my degree, I moved into a social work position where I am now, doing case management and family therapy. I stay at Hawthorn because of the people, the mission, and the kids. I'm somewhere that I know I make a difference, not only in the lives of my clients, but in those of their families and my coworkers as well. Hawthorn has helped me grow not only professionally, but personally. I'm a better person for the journey I've gone through while here at Hawthorn, and they have supported me all the way.
Hi, my name is Eric B. Lilly, and I am an RN, the day shift supervisor at Hawthorn Children's Psychiatric Hospital. I actually started in mental health as a teenager working at Hawthorn when it was on Filer. I worked in the activity department, and that was my introduction into mental health. Now, why I became a nurse, the short answer is to be of service to others and to better understand the human condition. At a young age, I was intrigued by how my elders used what they had to help people recover from hurt, harm, and illness. Harm, I learned, spoke to wounds or altered function that required more than bandages to support healing. For me, nursing provided a way to learn how to care for the entire human, Nursing taught and supported ways to save people when required, to prevent hurt, harm, and illness. And nursing advocates healthy living, and I like that. What made me decide to specialize in psychiatric nursing? It was my perceived need for diversity that drew me to psych nursing. Men, and especially men of color, are underrepresented in healthcare in general. Men struggle to seek care when physically vulnerable. Seeking mental health care can be even harder for some men to do. My hope has always been to advocate for care and to be a visible role model to men and others in need of support during vulnerable points in their lives. Support for mental health and diversity, when demonstrated, can improve health outcomes. Now, what drew me to Hawthorn? As much as I love kids, I love and respect the individuals who care for them even more. Caring for your own child can be tough at times. Caring for others' children requires a discipline and consistency that is hard to do and even harder to teach and support. Hawthorn demonstrates excellence in caring for youth and supporting the optimal health outcomes for youth and their families, and I wanted to be a part of that noble work. Now, what made me stay so long? I'm still here because in my core, I believe in the work that is done at Hawthorn. Hawthorn, and I can't say this enough, saves and changes lives on purpose. It is my belief that Hawthorn has literally prevented the death of and changed the life trajectory of thousands of Missouri's families and Missouri's children. It is my belief that the work done at Hawthorn makes a difference. And I am proud to do this work, and I am proud to share this work with these noble individuals that do it with me. And I stay so that this work continues.
Hi, my name is LaToya Young, and I've been here at Hawthorn for about 17 years. I started back in 2006 on the evening shift on adolescent unit. It's where I became and got all my good training and strength from. About 2.5 years later, I started on day shift down in residential Cottage D, and it's where I became more family-oriented with the hospital. And about 10 years after that, I came to the RT department, where I am now as an activity aide. We do all the therapeutic activities and all of the fun stuff with the clients. To me, Hawthorn is family. Hawthorn is togetherness. It's emotional intelligence, all wrapped in one. Everyone here is like a family. It's just such a warm feeling just when we're together. I think that Hawthorn has taught me so much, from the clients to the doctors to the techs to everyone here. I learned and I can use in my everyday life. And I just think that that's a great aspect of Hawthorn, and I just love it.
Hi, my name is Elizabeth Schulte, and I am the Chief of Clinical Services at Hawthorn Children's Psychiatric Hospital. In this role, I have the opportunity to provide support and oversight to several departments within the facility, in addition to the inpatient and the residential treatment programs. I'm on the executive team, and in that role, I get to help make decisions that affect the facility as a whole. My background, though, is in social work, and I chose social work because I really loved some of the basic principles of social work. And I also learned in school that with a degree in social work, I could pursue many different types of treatment. And so that's really where I wanted to focus. My career in the Department of Mental Health started about 16 years ago when I was a practicum student at a sister facility that provides adult mental health treatment for psychiatric conditions. And that's where I found out that I really, really do love providing mental health treatment. And so upon graduation, I got a job at the agency that I completed my practicum and stayed for a period of time, developed my skills, and actually went on to become the director of social work, which was also a wonderful experience. And I've been in this role at Hawthorn for the last year. I came here because I really wanted to learn more about how to use my knowledge and expand it further to help children across the state that need services that only we provide. And so this has been really meaningful to me. Throughout my career, I have felt very supported and encouraged to try new things and to expand my own skill set. And I hope that when you've listened to this video and you've watched and you've heard from other team members that you've heard sort of similar themes. This is an agency and this is a department that really believes in supporting our team members and helping them do the things that they want to do. Thank you so much for taking the time to watch this video. We really hope you learned some things about Hawthorn and about the team members that have helped support this wonderful facility.
That was great to go inside Hawthorn Children's to find a little bit more about how they help individual students, children each day overcome their issues with mental illness. With us live is Michael McFarland. You saw him in the video. Now he's with us Zoom live. Michael, thanks for joining us. You have the floor.
I really appreciate everyone's time and attention today. Just wanted to let you know that, we are a branch of the Missouri Department of Mental Health. We're a state-operated facility. And there is no general health without behavioral health. We are thinking, feeling individuals, and it's very important to treat the entire person. And so much of that is emotional management, treating children and adolescents who are in distress and are struggling with acute psychiatric disorders. We have an inpatient program here for both children and adolescents who require stabilization and short-term stays. We also have a residential program that after people complete the inpatient program, they can be transferred to residential so that we can look at community supports and community reintegration and returning them either to their families of origin or a placement that can better support them in their psychiatric needs in the community. And of course, in addition to the behavioral stuff that we do here, being nurturing, compassion, mental health care professionals, of course, we do medication management, talk therapy. We have an on-site school to meet their educational needs. Recreational therapy is part of treatment and recovery. And we really believe in the dignity of children and adolescents. And it's a pleasure to serve, to be a public servant in this capacity with children and, even more importantly, their families.
Michael, that's great to hear, and thank you so much for the value add you do for the healthcare system and really to the individuals around the state of Missouri. We have a couple questions coming in, and I just want to ask before we get to some of the questions, is Ann with you, and is she going to be Zooming in?
No, Ann is not with me, unfortunately.
Okay, no problems, just want to double check.
Okay.
So we have Columbia Area Career Center asks, how do you deal with an aggressive patient?
Yeah, I started while the video was going on, typing in the chat that we do a lot of listening. We ask them what the source of their distress is currently and how we can best help them. Space reduces pressure. We remind them about their safety plans. All the children have safety plans to help them with coping mechanisms. Sometimes it's as simple as offering a child noise-canceling headphones. We do a lot of redirection and trying to get their attention off of, they may be distressed because they feel provoked by another patient, or they may not have liked a response, maybe being told no by staff as far as limit setting because they couldn't have something at that particular time. We also tap out with each other because we always intervene in behavioral crises as teams. And so if I'm the focus of a young person's distress, somebody else will come in to redirect and make them the focus, and I'll remove myself out of the picture. So there's just a lot of creativity and a lot of talking and dealing with aggressive clients.
Yeah, I would think that would probably be the most stressful parts of the job, is dealing with somebody that's under duress and really challenged and trying to figure out how they can cope with their situation. A couple more questions have come in. We have a student out there. What characteristics are needed to work in mental health facilities?
It's an excellent question. A lot of patience and intellectual curiosity, really trying to understand what's motivating and driving that human behavior. I always encourage people to look at the histories and the patient charts and the intake paperwork to see what has happened to this young person prior to their admission to Hawthorn to have a better understanding. You're looking for behavioral clues, and you have to be very clear about what the short-term and long-term goals are for that patient while they're here. There may be ways you want to help, but at the end of the day, it's really driven by the patient's needs. And to have a better sense of those needs, you need to know what the short-term goals are and the long-term goals are, and what you can do best to assist that patient. So I would say intellectual curiosity, engagement, compassion, an interest in helping people, an interest in being a part of the solution instead of a part of the problem. I always tell people you can plant seeds or pull weeds. And as a healthcare professional here, you really get to plant seeds and give people the skills and the tools to return to the community and erect very meaningful lives while managing their mental illnesses or disorders.
You know, following up on that, we had a young lady that put something in the question box and wondered, you know, to follow up with that, can you work in mental health if you've had issues or personal mental health challenges?
Absolutely. Absolutely. You know, I did a study back in 2010, so I apologize, the data is dated. But at that time, when I was doing the training, rather, there was a study that said 83% of mental health care professionals have mental health issues and struggles of their own or in their families of origin. And prior to becoming the chief operating officer, I was also the HR director for this hospital. And one of the things that would always come up in interviews is I would ask people, what is their personal story that drove them to mental health services? And inevitably, there was usually a story in the individual's family of someone that had their own mental health issues and challenges, or someone who may have struggled in high school or college with an acute episode of depression or feelings of hopelessness. And so, being that they were able to negotiate their own challenges, they inevitably want to give back and help other people who are going through those same or similar challenges. And it's very gratifying work to be able to get paid to do that.
You know, and I would think they bring a very different, compassionate lens to that situation, knowing that they have had a background with that.
Yes, empathy is very important. I always tell new employees and during your employee orientation, the therapeutic alliance is what best assists patients through their treatment and recovery during their stay at Hawthorn.
Well, Michael, we have time for one more question. Actually, if we can. The question is from Christian Brothers College High School. How can a high school student begin their journey in the career of behavioral health?
So I would say it's a very good question. I would say a good place to start is volunteering, or perhaps you attend a school that does service learning on the weekends. I think skilled nursing facilities, nursing homes, assisted living communities, working with the elderly is a great way to begin working with people of varying levels of behavioral functioning, mental health functioning, but who are also very grateful for your time and attention. I myself volunteered. My mother was a geriatric nurse, and I volunteered in a nursing home from the age of 7 to 15. And I absolutely equate those volunteer hours to the reason that I do this kind of work today. I would say for seniors in high school, as long as you're 18, consider spending time during the summer working in a part-time capacity with our hospital, working with the recreational therapy department and assisting them with facilitation of activities for our kids, particularly our younger children, ages 8 to 12.
Fantastic. Well, Michael, thank you for your time today and zooming in for Healthcare Career Day. And really thank your whole team there at Children's for all that they do to help individuals get back on their feet.
Thank you for the invitation, and this has been wonderful.
Absolutely.